Coming up on Business Spotlight, Johannesburg partners with the world's leading brewer to accelerate socio-economic transformation. And the city's clinics get smart with e-health. This week, the city of Johannesburg and Anheuser-Busch InBev announced a multi-million rand partnership. AB InBev, the world's leading brewery, has committed an initial 50 million rand over 5 years, designed to boost enterprise development and implement an effective alcohol abuse outreach program.
The important thing about this partnership is that it's looking at two critical programs. The first looks at the harmful effects of alcohol abuse and the reduction of harmful effects of alcohol abuse and responsible drinking approaches, which is a program that AB InBev approached the city of Johannesburg about, and identifying Johannesburg as a critical site to initiate an international program on reducing the harmful effects of alcohol abuse. And this would include looking at impact of accidents, non-communicable diseases, and those sort of programs that would be implementing jointly with AB InBev, including creating literacy, knowledge and awareness of the harmful effects of alcohol abuse, symptoms that people need to be aware of and how to mitigate and deal with those. The second leg of the program is about enterprise development and job creation opportunities. And in many ways, the first part links the two because it's about the development of frontline officers that would be in communities doing the work, mobilizing people, creating awareness, using our digital platforms to create awareness and knowledge. This is about 6,000 young people in particular that would be deploying jointly with AB InBev. But the second level is identifying opportunities along the value chain for enterprise development opportunities and commercial opportunities for local people in Johannesburg.
At AB InBev, we've set forward some global smart drinking goals, some of which you see right here, where we believe we can move beyond responsible drinking to smart drinking. And in doing that, one of the most important areas of affecting people's lives is the cities in which they live. So we've been establishing a harm reduction framework and thinking of how we can work best in partnership with appropriate people in cities and communities around the world. And as such, Johannesburg, in the interest of the mayor as well as the people here of leading healthier, longer, happier lives, has come into our interaction, and hence the discussion of this project for harm reduction on alcohol.
Johannesburg's Growth and Development Strategy 2040 aims to create a productive, sustainable, livable and caring city. Mayor Park Stow says this partnership with AB InBev aligns with the city's strategy. It
takes forward the implementation of the GDS 2040. It's about the reduction of non-communicable diseases, which is the leading cause of premature mortality and preventable morbidity in the city of Johannesburg. So it's very important in our GDS that we reduce premature mortality and morbidity and create a better quality of life for the people of Johannesburg. The second element, of course, is about creating a livable Johannesburg where people have access to economic and social amenities and opportunities. And in this regard, we're focusing on creating opportunities along the entire value chain of the production of beer and related products, and creating small opportunities for small enterprises and community-based enterprises for AB InBev, with the support, of course, of the program management team that we're jointly putting in place.
AB InBev has its African headquarters here in Johannesburg, but the goal of this partnership is part of its broader responsibility outlook.
The ultimate goal links into the global goal of a 10% reduction in harmful use of alcohol by 2025. This is not going to happen overnight, and that's why the World Health Organization and UN and others have tried to put a whole of society approach. We believe we can do this with the city of Johannesburg with the use of new technologies, new communication programs, appropriate media discussions, to get people to make better decisions about how they interact with health as well as how they interact with alcohol in their lives. We've learned by looking at the evidence in public health, if you look back to Framingham, Massachusetts on the Framingham Heart Study, which led to a reduction in cardiovascular deaths in the United States, as well as if you look at the North Korea-Finland project last century, now 30 years hence, have lowered cardiovascular disease deaths and increased life expectancy. There's great evidence that working in cities on public health issues can make a difference. We believe Johannesburg Johannesburg, similarly will garner that value as we go forward over time. And this is just the beginning. So, of course, when you launch something, you've got to have the architecture that's right and in place. And as the program develops, we expect to have more and more opportunities to showcase success for people of Johannesburg.
Ratson says the program will have a positive impact on the brewers' bottom line.
I'm a public health physician, and I say health is the common currency everywhere. So a healthier public is going to be better for everyone. So, of course, on the bottom line, it will help make a difference. And you can extrapolate all sorts of ways, of not only the number of consumers, but not only the number of consumers in whole, but also the number of consumers drinking appropriately. And that's our hope. We're not trying to increase the number in terms of harm. We're trying to decrease the harm and increase the happiness and health of consumers.
Here at the Jabavu Clinic in Soweto, the city launched the first implementation of the electronic health record system called eHealth at Joburg.
We did a survey of the users of our clinics, and we asked the question, what affects you the most at our clinic? Actually, they did not complain about care as much as they complained about the queue. They complained about waiting times, about records, and about the queue. So how do you use technology to enable you to deal with that problem, to improve health care, to improve access, to improve the quality of service, and to reduce waiting times so that you are able to give a better service to the people? How do you ensure that you can keep records in such a way that, and I know many of us who are not medically inclined, when you go to a doctor and they ask you, are you taking any medication? You say yes, and they say, which medication? How do you expect me? Firstly, those things are written in some complicated English I don't know, and half the time you're asking me to answer this basic question. Now, this keeps the record on the system so that you are able to if you get your record on the system, the doctor would know what medication you're taking, what conditions affect you, and what treatment you're getting for the different conditions, and they are able to take the precautionary measures and the mitigating measures to deal with your condition, so that we don't have mistakes that are unnecessary.
The system is designed to drastically improve turnaround times, record keeping, and services in clinics.
Our clients would go to the health facility as early as 4:30 in the morning to beat the queue and to be the first on the queue, but they would also wait for long time, waiting on the queues, polishing the seats. And then the other challenge was that our health practitioners did not have sufficient time to focus on the patient, because they had to fill in the records, fill in the forms. So all the manual system is actually very tedious to save time for the patient as well as the health practitioner. So we then thought as a city, through the executive mayor, who said that we need to test an electronic record system and see how best we can deal with these challenges that we are faced in our clinics. Especially elderly people, chronic elderly people would wake up very early in the morning, and that time the clinic gates are closed, because we do not open the gates before the actual time of opening of the clinic.
The turnaround time from the time they came in to get to the file was about 40 to 45 minutes. Then they'd have to go and wait again for the first part of the treatment is vital signs, and that could be another 30 to 40 minutes depending on the numbers of staff or numbers of patients in the clinic, and depending on where they were routed to, there'd be another 40 to 45 minutes. So some of the stats that the city has is turnaround times from point of entry to leaving the clinic with your medication could be up to 4 hours sometimes. So this system will dramatically reduce those waiting periods, and that's going to make a massive change in the lives of the people that require these services.
Patients' records will be accessed via a biometric system which will record and reveal their details using fingerprints. A patient's information can be accessed at any hospital or clinic in the region.
I must say that this system is very revolutionary. Because if the customer has an appointment, the customer then gets reminded by SMS, automatic SMS from the system. Also, the reports will be generated by the system. So our health practitioners won't be writing reports, sick notes. The system will generate all those. But what is more important as well here is about the confidentiality of the patient. Because only people who have a code and who are authorized will be able to access the patient's record, especially the confidentiality of the patient, which is between the doctor and the patient.
Now in phase 1 of 7 phases, the system is currently being rolled out in 15 clinics in Johannesburg, with a further 15 planned for phase 2.
The implementation of such a system requires extensive change management. Together with the City of Johannesburg, we've got in place our staff who are on standby all the time for the entire rollout period. And there will be supporting staff throughout the process. So all staff undergo a week or 2 week extensive training process. Thereafter, there's on-the-job training as well. So that change management, moving from the paper file to the electronic system, is absolutely vital. And we have support staff to ensure that the nursing sisters are able to get help when they need help.
Revolutionizing healthcare services in the city, the eHealth at Joburg system will be implemented in 81 primary healthcare facilities in the coming months.
Electronic health records have been around for a long time. In South Africa, they've been around for the past 15 years. You'd find them mostly in private facilities, in large mining houses and so on. So if you go to Anglo Mines, you'll find an electronic health record there, gold fields and so on. So it's been implemented in private environments where it's easier to manage. But I must say that this is the first public implementation of an electronic health record in primary healthcare. Albert Lutuli in Durban has an electronic health record that's also public, but it's a hospital. And this is a primary healthcare facility. And I think it's by far the largest implementation in South Africa today.